Oh wow, that's definitely a difference.
Alright, so what brings you to clinic here today?
Mostly restriction in my ankle,
okay.
flexion,
okay.
along with other things, including, I had some knee pain here, and then hip pain as well.
How long those problems has been going on for you?
Years, at least 10 years, I would say.
10 years
for the ankle.
So you said that you had a problem dorsiflexion, which means that you cannot bring the ankle up. You couldn't do that for the 10 years, for the past 10 years.
Well, mostly when squatting.
When the squatting is, yes.
Yeah.
So when you have extreme like an ankle movement that you couldn't do as well for the past 10 years.
Yes.
Any kind of injuries you had in the past?
Not any specific injury. I mean, I grew up playing sports, football, soccer, rugby, so
gotcha.
It could have been something you just played through.
Gotcha. And then you also have a knee problem that you said that you're having difficulty with, which is also on the right side. So right foot, right ankle pain,
yeah.
right knee pain, and you also have right hip pain.
Yes.
So everything the right side doesn't like you.
Exactly. And I'm right-handed though.
So you have a right knee pain, right foot pain, right hip socket pain,
yeah.
And then you also have a right low back pain. Am I correct?
Yes.
So everything's just kind of all connected.
Yeah.
So it's all started. Am I correct? All started with your right ankle being a little bit out of the place, unable to move your ankle up and down. Everything just kind of screwed up after they're on. Is that correct?
I feel that's correct.
Okay. Some of the things you cannot do. What can you not do as easily?
I mean, the main thing is just squatting full depth.
Okay.
Everything else, I probably have some sort of compensation I've worked around over time,
okay.
But nothing else that seems to be restricting me.
Okay.
But I would say generally, like, I feel like that ankle issue caused other weaknesses that, I feel like I should be able to run faster than I am.
Gotcha.
I feel like it's kind of affecting athletic performance, you'd say.
Gotcha. So right now, is your ankle movement restriction, is that kind of hindering your daily lifestyles at any point?
Just daily work, not so much sitting at a desk, an office job, but definitely recreational.
Recreational,
I feel it.
And then you and I kind of talked about it just a little bit. You told me that you also have a hard time sitting.
Yes.
And then when you are sitting for a long time, because I know that you have a desk job, so when you're sitting for a long time, does it kind of increase the pains on your knees and ankle just by sitting, or does it just kind of have...
So I would say typically, like, I want to slouch and twist is like my normal kind of default mode, and after long periods, it's actually the inner groin area that starts to get tight the most, as well as the kind of, I guess, the low back cuboid area.
Yeah. And then after that, your knees and your foot start to become like achy and things like this.
Yes.
Okay. Although the problem started with the ankle and then went up, but the problems that you experience on a daily basis is your lower back, your knee, and then shooting down to your ankles and all the other areas.
Yes.
Okay. You notice that your nail actually has a little giant big line over here.
What? In the middle?
Yeah, in the middle.
So I lost that nail
yes.
doing a race about 6 months ago.
Do you know why?
It was probably rubbing the top of my shoe. I got a blood blister.
Yes. So this is actually something that I want to be able to let you know that this is not a coincidence. But I want to be able to let you know this is actually something that's very, very common with somebody who has a problem on the ankle. Mm-hmm. This is a very, very common. I want to be able to kind of mention this to you. The reason why is because the ankle, when it's not moving so much, when the ankle is not moving like this, guess where it compensates? Here. So if you're not able to move this much, either your knees or your small toe or your big toes have to compensate. So this actually move in compensation of your ankle not moving as much. Yeah. And then you said that you have some pain on this side right here, yes?
Yes.
In the middle of the metatarsals where the bones are.
Yep.
Notice that you also have what we like to call hammer toes, which means that your toes are actually curling up like this because of the fact that you're not able to grab the floor as easily because of the fact that your ankle is not being able to move this up and down. Mm-hmm. As I've said, your big toes, your small toes have to kind of compensate moving up and down. In relations to that, you're developing or curling up your toes, which is called hammer toes. Does it make sense to you?
Yeah.
Can I tell something really interesting? Mm-hmm. I know that you've been telling me all the pains are on the right side, but this side actually is weaker.
That's complete news to me, honestly.
Push down again. Yeah, you're pushing down, but you see, you actually notice how you have to use all the muscles over here to be able to push down. Mm-hmm. You actually have to focus so much on the left side to push down. So push down again for me, please. You notice that you have to bend extra. You see it bending at the joint here extra because of the weaknesses. But that tells me one thing. This may not be a structural problem coming from the foot and ankle. That's exactly what I'm trying to kind of get at you. This is not really. This is a foot problem. I did some inflammations over here. I certainly found more inflammation on the left side, to be honest, than the right side. There's definitely a foot joint dysfunction. I'll be able to go over those with you. But the strength in over here like this are actually more than your foot and ankle area. That's exactly what I'm trying to tell you. Yeah. Does it make sense?
Yes.
We kind of talked about how the right thigh over here is actually pretty full and rigid and then stiff and then pretty strong. Left side being kind of mushy and soft. Go ahead and feel those muscles out for me. Do you notice the differences?
Yeah, a little bit.
So this one is right at 16, as you can see. So it says right at 16. If I go here like this, what does this tell you?
Yeah, like 15 and a half.
15 and a half.
A little bit more, yeah.
So there is 0.5 inches of muscle being wasted on this side. This is called muscular degeneration, which means that it's like arthritis for your bones but for your muscles. When the muscle does not get proper supplies, it actually does this. It's weak. On this side, you can see this is actually much more flaccid. It has about 0.5 inches of muscle mass here already. All your problems on the right side.
All the problems are here, but I understand that.
Left side is actually
it's smaller. That's all I understand.
Yeah, and then left side, and then the left foot was weak too.
Yeah.
Weak left foot, weak left thigh. All the pains on the right side.
Yeah.
So I want to be able to ask you what that could be. What that means to me is this problem that you're actually experiencing is actually more than what you're actually seeing. So all the pain on the right side, all the weakness on the left side. If you have truly a left thigh problem, you should have pain and also weakness, smaller muscle weakness, and smaller muscle mass on the right side. Does it make sense to you?
Yeah.
If you have some of the features of the chronic problems on one side, some other features on the other side, that means you actually have problem above this joint, which is going to be in this regions.
Okay.
Does it make sense to you?
Okay. Yeah.
What that actually tells me is, if I'm actually able to take care of this regions right here, if I'm able to take care of your low back problems, guess what? Some of this is probably going to be self-resolving. That's what it means to me.
Okay.
Does it make sense to you?
Yes.
All right. So one thing that I actually noticed without going much further, I can actually see that there's a lot of stiffness on the right side. More than that, I can see your entire body has shifted to the right side here like this. That's number one thing. And then I also know that there's a lot higher shoulder here than the left side. What that means is that your right shoulder is raised up with your entire body rotated through this way. So your entire body is literally rotated through this way here like this. You understand what I'm trying to say? Almost like a twisty top right here like this. What that means is there's some kind of problem, some kind of structural problem going on here, or on here, or around here, that actually torquing your entire body. That's actually putting a lot of pressures on the right side. Right knees, right foot, and then also on your right hip. That's the reason why you have a lot of pain on the right side. Does it make sense to you?
Yes.
And that's really what's so unique about your case. I found the small problems in the sitting bone area that's actually responsible for a lot of the movements when you're tiptoe walking or heel walking. I found the problem right here. Right about here is also painful, yes?
Yes.
That's the area that you always ask your wife to kind of quote unquote crack for you, yes?
Yep.
One thing that I also want to be able to let you know, all this is not fat. This is not fat.
Yeah.
That's fat. This is not fat. This is swelling. So probably if I ask you to choose top two, you'll probably say this one and this one. Am I true? Am I right?
Yeah.
There's a lot of swellings. All this, follow my outlines. This much of swelling in your body right here is caused by this. This is fat. This is swelling, edema.
Yeah.
This much. So almost the entire lower back area is actually caused of the swelling because of this one tailbone right here. Those two. So that actually is.
That's a good one, actually.
You're not really able to. Can you do it again? Yeah, I can see that you cannot really squat as easily.
Yeah, like
on the right side. Gotcha. Go ahead and walk tiptoes for me, please. So the right side is definitely weaker. I can see that. Go ahead and turn around. Yes. Go ahead and turn around and then do a tiptoe on the right side. Yeah, right side is very unsteady. You feel that too, right?
Yeah, oh yeah, definitely.
Yeah.
Even just standing like on one foot, like this, the right side is just completely wobbly.
Just out of curiosity, let's do the left side. Left side is okay. I can see that that's actually pretty stable. But let's do the right side again. Oh yeah, I can definitely see that. Yeah.
I'm literally shaking.
Yeah. You, my friend, have two problems. Number one problem that I actually see is your entire sacrum has rotated this way. Like this. You see how there's elongated, like almost like a teardrop shape kind of shapes over here? This is spinous process that you're actually seeing over here. What that actually means is, look, your entire body is rotated through this way. Your entire vertebrae is literally pointing the left side, like this. And then guess what? Your entire low back, all the way up to the mid back where I told you there's a lot of pressure and I said this is causing so much inflammation. It rotates all the way to the left side up to there. From there on, it switches sides all of a sudden and then goes to the right side.
Oh, wow.
So it's a tremendous amount of torque on the your spine all the way up to your mid back area. What that means is your entire body is literally when right side here like this up to here. Why? Because structural problem. Which structural problem? Of your tailbone.
Okay.
So this is your right foot x-rays. I want to be able to just kind of zoom in so that I want to be able to show you. You actually have not a foot problem. You actually have a fibula. This is called fibula, which is one of the ankle bones that actually attached to it. It moved backward.
Okay, there we go.
It moved backward. When it moves backward, guess what happens up top? It actually locks up the top because this is way too backward.
Yeah.
So what I'm going to do is I'm going to put this more front.
Okay.
So that it's going to be having the normal range of motions. And then you see a little bit of a like jiggliness right here. It's almost like a fuzzy lines right here.
Yeah.
You're right. There are problems with your talus. This bone is called talus, where the ankle and foot meets. You do have a little bit of a starting of the arthritic changes right here. Why? Because this joint is not moving as much. You see that? I want to be able to zoom in so that you'll be able to see a little better. You see that little bit of a like spike right here. You see a lot more whiteness over here. Why? Because the bones are depositing more bones over here because this is not grinding as easily. So I want to be able to don't worry about that. There we go. You felt that?
Oh yeah.
So what I'm going to do is I'm going to make a contact right here. I'm going to sink a little more. There we go. You heard that? All right. Oh, you already went. I think it fell. There we go. All right. This is why you came to see me today.
Definitely.
You ready? You felt that?
Yeah.
All right. A little bit, not so much. There we go. You felt that too.
A little bit, yeah.
So I'm going to do your cuboid, which is right here. A little more. There we go. What the difference is now?
Oh yeah. I mean, it definitely feels looser. I mean, I could feel like, some kind of blood flow coming into the area, but definitely different. It's hard to really describe. After you've been stuck for so long.
I know.
Like you really just feel kind of like a blood flow, really. Kind of things starting to loosen up after, being tense for so long. It almost feels a little weird. So,
you are a lot more stable though. I can definitely say that your stability is much better now.
Yeah, I definitely feel it's like I'm using my calf more. And I feel like it's like kind of, I guess you'd say, extending at the ankle joint more. Like almost equally. Whereas before it felt like it was like 15-20% less than the left side.
Yeah.
Oh wow, that's definitely a difference.
How much improvement? 0 to 100% on your right ankle?
95 plus.
95 plus. I like that number, 95 plus.
Yeah, I like it. Yeah, it just feels a lot better. I got a feeling that's what's going to really help out.
Yep.
Everything, but like my running, I think is going to help.
Yeah. Hi, this is Dr. Lee. Let's compare the tiptoe walking before and after. Notice before how he is shaking his leg, he's walking. That means that he has instabilities coming from his spine as well as his leg, preventing him walk straight. Notice how he's able to walk properly after the treatment, and notice how he's also able to have a larger stride, and then notice how he's using entire leg and foot function as he's walking. Thank you very much for watching. Take care.